Call this meeting to order. Attendance, please.
Artis. Here. Don.
Here.
Grant.
Here.
Jim.
Here.
Mike.
Here.
Rod.
Present.
And Toby.
Here. Right. Please rise and join us in the pledge of allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Like a motion for approval of accepting the agenda, please. I make a motion.
I'll second it.
It's made and seconded to approve today's agenda. All in favor, signify by saying aye.
Aye.
Opposed? Motion carries. Now we have citizen comment. We had one person that wanted to come forward and address the board.
Yeah. So, hey guys, hey again. My name is Adam Litzberger, if you haven't I've talked before, but it's nice to see you again. I just wanted to kind of tell you guys our story. We're applying for a variance this council, this committee time. And so just want to talk to you through kind of the situation, help you understand our situation. So my girlfriend and I, we really love Montana. We bought our dream property out on Ashley Lake last year, so early in the year. It's a really small cabin. I don't even think you qualify as 2 bedrooms. It has a loft, no closets. And we always had a dream of being able to rebuild and really make it larger so we could raise our family there, right? Have kids and really make a life there. So I guess we're in our 30s, as you kind of know, and we just want to have kids sooner than later and be able to build. When we bought the cabin was permitted legally by the Flathead County for a septic system. Unfortunately, when we moved in, it was immediately invalidated. The permit was taken away from us. Why, you may ask? Our neighbors, we actually have an easement on our neighbor's property that supports the draining field. We discovered, and it was discovered by us, that they had built a garage over our drainage field. That's nothing we could control. We weren't aware of it. And unfortunately, that meant the county had to take away our previously valid permit. And so we were kind of left in a situation where we don't have, a lot of opportunities. We've worked for the last over a year and a half, essentially, since we bought the property to try to come to some type of a solution that would be reasonable and follow all of the regulations. Unfortunately, having worked with Jim and Jake and the health board, there's no solution that would be allowed with the current regulation. We have an older lot. It was built, the vision that was built in 1953. It's pretty small, just not big enough for non-degradation because of the proximity of wells, the lakefront, and down gradient, those types of things. Even if we were to reuse our neighbor's easement, take out the garage, which legally we could do, the county has told us we don't have, that would not meet the regulations, and so they could not approve us even to replace our existing septic system. So that's why we're here today. We want to do the right thing. We want to have a valid working permit. Technically, I don't think we're allowed to live in our house because we don't have a permit for the place. And that's why we're here proposing this variance and this, appeal and variance for the septic system via an incinerator. I'm going to talk to you through about what an incinerator is and how it works. We've talked about that. The incinerator, really, it works similar to, it's a new technology that works similar to the existing drainage field and septic solution. You take the waste that will be pumped into a chamber or a tank. That tank has pumps and sensors. Once that sensor gets enough, waste, there'll be a pump that pumps it up to this incinerator, which is housed in a structure to weather the Montana weather. And then it burns off all of the waste into sterile ash. So we know that this is actually better for the environment. We're not putting any water into the groundwater, jeopardizing our neighbors' wells, our well, or the Ashley Lake. And it meets, there's been significant testing done in a lot of different reports. Thank you so much to Jim and Jake for taking a look at all of these reports that go in fine detail about the amount of particulates that are coming out of the ash and the air. And this meets all EPA regulations. So really, this is better for the environment because we're not polluting the groundwater. And the ash as well, you know, the air emissions are within regulations. And the ash is sterile ash that can be, we've talked to the Flathead County, the regulate, like the dump or whatever you want to call it, the landfill, they can accept this ash. So really, this is better for the environment. Not only that, but the DEQ also approves of this. So we've talked at length with Sean Rowland and Rachel Clark at the DEQ, and they've told us that they're supportive of this case. They've actually approved multiple cases, not in Flathead County, but in the state of Montana and other counties. So there are precedents of having already approved this. What they've also told us is that Flathead County, so this board has the jurisdiction to make a case and to approve a case today. So you guys do have this ability to approve it. And they've also, working with Jim and Jake, they've given us language in order to us be able to see exactly what that language would need to be from these other counties, so we can mirror that in Flathead County. So in summary, you know, we're looking for a solution. We just want to do the right thing, and we want to get our house in a livable situation. You know, we know that this is better for the environment, for water quality, and we also know that the DEQ is supportive. We desperately need a solution now, today. You know, we want to start a family, and we want, you know, to be able to live out on the lake. So this would mean the world to us. I just want to say, you know, your vote could change our lives. So you definitely appreciate your time and your consideration. And yeah, thank you. The last thing I'll say, we did in the commentary, we put two proposals, basically two options that are going to appear of how this incinerator system could work. What you'll see is our lot, the black and white is our main house that's existing, and a proposed ADU. The light blue is actually lake. This works similar to other systems. So the red dots are tanks, like a septic tank that would exist, that would have pumps within it. And then the blue or the dark blue squares are the incinerator system that would burn off the waste. In option one, this would just be burning the liquids. So the septic tank would house the solids. And we would pump that like a regular septic tank, like in the past, like any other thing that you guys have already approved within the county. In the second option, this does have the ability to both burn solids and liquids. So that's the setup that would work very similarly. The only difference here is in the septic tank, you could do a single chamber and you could use two grinders to grind up to the two incinerators. All right, so that's my commentary. I probably went over time. Just again, really, really appreciate your thoughtful consideration about this case. And thank you so much.
Thank you. Any further public comment? I don't really see anybody. We're going to be addressing all this shortly. All right. Next is approval of the minutes from June 20.
I move to approve the minutes as presented.
Second. Motion's been made and seconded to approve the minutes of June 20th, 2024 meeting. All in favor, signify by saying aye.
Aye.
Minutes are approved. Next is appeal of health officer's decision regarding Litzenberger action. It's an action item, so we'll go to the health officer's decision first.
So, they appeal to the health officer, and I would, suggest that we, let's see, I'm gonna get the wording correct. I would ask that you uphold the appeal to the health officer, so that it could move to a variance.
All right, may I have a motion to uphold the decision of the health officer?
I move,
I'll let you go.
okay, I move to uphold the health officer's, decision.
Okay, discussion. And seconded? Yeah, seconded. Been made and seconded. I guess we'll do a roll call on this, please.
Artis,
Yes.
Don,
Aye.
Grant,
Yes.
Jim,
Yes.
Mike,
Yeah.
Pam,
Yes.
Rod,
Yes.
Toby.
Yes. Motion is approved. Next, we'll go on to the actual variance request. And, again, I'm not sure who to speak to concerning this.
Jake, do you wanna, or Jim, do you wanna?
Good afternoon, I'm Jim Wardensky with Environmental Health.
And, this is a little bit of a unique situation because typically when we have a variance application, there's usually a engineer or consultant that represents, the applicants. And in this situation, although they do have a consultant that they're working with, he was unavailable today. And because this is the very first incinerator system that Flathead County has ever, brought to a variance process, considered for permitting. Probably, Jake Rubo and myself are the most informed about it, other than Eco John or Septic John. And, so, in the packets that we forwarded to you, the variance packets, there was a memorandum that Jake, composed, with all the findings in there. And because we've already had a special Board of Health meeting and then the subcommittee meeting, and I'll allow the subcommittee to present, the information there. I'll merely say that environmental health is in support of granting this variance. Again, in the paperwork, all the findings are there. We've done the research. We don't feel that it would jeopardize, the environment in any way, so.
Thank you. Any further questions?
Yes, sir.
The original. So, there's a point where it says that there's no acceptable way to meet today's regulations. Is that in reference to the upgraded 3-bedroom, 1 ADU, or even with the existing house that's on there?
Even with the existing.
Okay.
Thanks.
And then the second question I had was, is there gonna be a significant propane savings and less burning when you go with like option 1, where you're pumping the solids instead of burning them?
Yeah, so one of the things that, as we looked at, I think the applicants actually presented two options, in talking with Eco John. And one of the things that, when Jake looked at it, the specifics of it, they have to have the capability of meeting the flows that are designated, the 300 gallons and the 150 gallons for each of the dwellings there. And based on the information from Eco John, the best way to do that is to merely burn the effluent. It would, require more propane, to burn the solids as well. And again, I don't know how deep in the weeds you wanna get with this. And again, this is a little bit different because typically we would have a design already presented from an engineer or consultant that, so some of this will need to be worked out. Really, what we're here today to determine is whether or not you guys are willing to set aside the waste segregation portion of the regulations, so.
Any further questions? Doctor?
Jim, is the septic tank in place already, or does it have to be put into?
It will have to be installed.
And is it the collection of solids which are not going to be burned, but have to be pumped out? Is there any difference in this type of system as opposed to a drainage system as to how quickly those solids will accumulate? Or, for example, will it need to be pumped sooner, or should we have some type of contingency that it should be pumped, say, in a year or two rather than 5 years, just to be sure that there is a problem that's accumulating more than it should be?
Sure. No, so it would function as a regular septic system. And one of the things that will be incorporated into this, if you guys approve the variance, is that there will be a maintenance plan that's required. And really, the maintenance plan will speak to the incinerator system and the maintenance of that. Because up until that point, where the sewage leaves the dwelling and into the septic tank, and then goes through a filter and into the effluent tank and is pumped to the incinerator, all of that will function just like a regular conventional system. So we don't put any mandates on a regular system as to how frequently they have to be pumped or any of that stuff. Largely, it's based on maintenance and usage. They say you should have your average septic tank pumped anywhere from 3 to 6 years, depending on usage. So, that would stand for these folks too, but, we don't feel that it's necessary to mandate anything regarding that.
Right, thank you, Jim. Any further questions?
I do have a question. So the variance is for, the gray water. So could we grant them the variance with John and say you can work with the county if you want to have the septic tank and it has to be pumped, or if you want the whole thing to be burnt?
Yeah.
Because that's what the variance is just kind of for the gray water, and could we say you work with the county and decide which way, if you want your tank pumped or it burns the whole thing?
That's exactly it.
Okay.
Yeah, exactly that.
Okay.
Any further questions?
That does beg a question then. If they decide to pump as opposed to incinerate solids, why do they need the county involved in that decision at all?
Well, because the way the regulations are written right now, we can't make that decision at our level because, again, like we talked about in the meeting, and I don't know if this was discussed in the special board meeting or the subcommittee meeting, but the way the regulations, exist right now, they talk about incinerator toilets and not incinerator systems. So it requires you to come up with waste segregation, and then there's a definition of that. That doesn't allow, it doesn't account for a system that takes care of everything. So we're really, it's just that regulatory component, that we're addressing, and, and then if you guys decide to grant the variance and we can, allow them to sidestep that waste segregation, then we can figure out, which system works best, as far as, burning the effluent or, all of it. There are some practical things that we'll discuss with the clients and their consultant, as far as tank placement and, it's a fairly steep location, there, so trying to get propane trucks and septic pumpers down there in the winter time if need be. The location of those things, how their structure is gonna be designed. Because, the system functions best from 32 degrees up to, 100 and whatever it is. Obviously, we have colder weather than that, so, there'll be some work to be done, but, the purpose of the variance is due to the waste segregation, so.
Thank you.
Yeah.
All right, any further? Sure.
Jim, this variance will carry forward with the property. So if these owners decide to sell it down the road, the variance will stay with the property.
Yes.
They seem like very conscientious people. Do you anticipate any problems with anyone else who may not be as conscientious if they do happen to sell by granting this variance?
Well, one of the things that'll occur, just like any other advanced treatment system, there'll be a deed restriction placed on the property. And, some, concerns have been expressed about the deed restrictions. However, again, they're fairly commonplace with, the level 2 systems that are being permitted. And then one of the things that gave me a little bit of reassurance is that as we discussed this internally in environmental health, I said, at some point in the future, if the rules change and allow them to have a conventional system, or there's a different technology that comes up, can this deed restriction be removed? And the answer I was given is yes, it can. So, the reason that exists on there is exactly for what you're talking about, is that all of that information is disclosed if properties are, sold and purchased by other people. And then it becomes problematic if it's not there and they say, hey, I didn't know that this was the only option. So it alerts them to that and, you know, that's the safeguard that exists.
All right. Anything else?
In other states that do allow these systems, such as Idaho, I know in the regulations, they stipulate low flow fixtures, and I know in one state I saw no laundry allowed, others were just high efficiency machines. Is that something that would be stipulated as well in our variance, or is it
No.
up to them to make that choice?
Yeah, it's up to them. I mean, there's maximum, flows that are, you know, in place. Part of what they can do is they can put solenoids in for water flow coming in. So if the system, you know, if they overuse the system for whatever reason, you know, there are two things, I guess, that EcoJohn talks about are solenoids for output and input. So the input would be for potable water coming in, which to me makes more sense because if you put it on the outlet side, potentially you're backing up into the house. Well, if you can't get any more water coming in, then you're not gonna have that problem. And there's alarms and stuff that are set on it. The reason I say no about the, you know, fixtures and all that, we don't have jurisdiction inside the house. So, you know, I mean, it would be very prudent for, you know, the user to do that type of stuff. But that'll be on them, so.
Anything further? Thanks, sir.
Thank you.
This time we have a motion on the floor to grant the variance and allow a septic permit to be issued and allow these folks to get moving forward on this. So I guess I'd like to have a roll call, please.
Could we have, the environmental health committee?
You want
Or,
to,
I just a brief
Yeah.
report, I know they stand approved that, so I just think it's important for the public to know that.
oh, well,
Oh, I can speak in all of us if we'd like. So we did look at it and, we were in favor of them moving forward with it and so forth. The one thing we did talk about is if they were going to have the septic tank pumped, or if the whole thing was going to be incinerated and so forth. And so we had that discussion. And our thing was, let's move it forward and hope that they could work with the county and pick whatever one that they choose to do, but grant the variance for the gray water.
okay, thank you, Ars. No, I concur, it was good discussion and it is, once it moves forward from this point, it's gonna go into the hands of the environmental health. And they will work their way through a set of plans and those things will be answered. So again, I'll go for a roll call.
Artis,
Yes.
Don,
Yes.
Grant,
Yes.
Jim,
Yes.
Mike,
Yes.
Pam,
Yes.
Rod,
Yes.
Toby.
Yes.
Variance is granted. Thank you, folks. Good luck, get your system in as soon as possible. Thank you for working with us. All right, moving on. Animal shelter, please.
Good afternoon, Austin Hicks here. You got the same report we always have here, nothing outstanding as far as numbers, nothing really surprising on there. I will say we did hit the 6-month mark, so I projected out for the rest of the year. And if we do hit that, we will have more animals that come through the doors this year than we have since 2013. So busy time for us. Currently, we're pretty full on dogs, so I stopped our owner surrenders for the next couple of weeks. So hopefully we'll get some adopters in and get back to business as usual pretty soon. So if you have any questions, I'll be happy to answer.
Are you seeing any parvo or anything coming through?
And we don't get a lot up here. I think that over the time I've been there, we've only had 3 or 4 cases of any animals that come through. So I think the cold winters help us with that quite a bit. So
I see. Thank you. Any further questions for him, sir?
Yeah, do we have an update on, extra staffing?
extra staffing. So I was full up last week, but I had some on leave. So right now I have one open position that I'm hopeful to get filled. We're working on trying to get some temp workers in there to help the staff in the meantime.
I think, Rod, you're addressing that we recommended for that.
Yes.
The commissioners did, they didn't approve it right then, we were working at the budget, and so they asked if I could reapproach it in October. Just because then we would know more about the tax things, but they did not say no, so they're,
Okay.
reconsidering.
Still-
It's still there, but yeah, but we're gonna revisit it in October.
All right, any further questions? Thank you.
Thank you.
Next is population health, please.
Good afternoon. I'm switching things up this month and starting off with chronic disease, so the main update I wanted to provide on that side of population health relates to our breast and cervical health, breast and cervical cancer screening program. So some very exciting news from that program. So each year we're supposed to enroll and provide services that ensure 425 program eligible clients receive breast and cervical cancer screenings. So as you'll see on the report, we ended the year with 433 clients that received services, which is very exciting. We haven't met the goal since 2014. So the fact that it was met and exceeded, we're very, very excited and very proud of our staff within that program. At the beginning of the year, they were bound and determined to make it happen this year, and we got creative with outreach and partnerships with local providers, and obviously all their hard work paid off. So a big congratulations and well done to Jen, Kimmy, and Malia within that program. And switching gears over to communicable disease, just have a couple updates on that one. So as you'll see on the report, syphilis, we did have 4 more cases reported last month, which is continuing to increase our caseload for this year. So far, even including cases that we've received this week, we're up to around 28 cases from the start of the year, which back in 2023, we had a total of 13. So we're well exceeding cases that we had last year. One thing that we really are wanting to reach out to the providers and let them know is that we're seeing more of an atypical rash with some of these syphilis cases. So instead of seeing the rashes occurring on the palms or the soles of the feet, patients are reporting rashes on their torso, their back, their arms, and their legs. So we're planning to get out a health alert network message out to the local providers probably tomorrow, just letting them know of the trend that we're seeing, and so they can factor that into their clinical assessments. The last update I wanted to provide relates to a situation that is still developing, so I really don't have too much information on it. So we've been working this week with our communicable disease team in conjunction with environmental health and the state health department on a cluster of E. coli, or the Shiga toxin E. coli, kind of a cluster. So far we've received about 10 cases within the last week or so. And we're working to reach out to all those individuals and do our case investigations and look through other avenues of information to gather as much information that we can to try to nail down the source of that pathogen. So more information to come on that. We really are working diligently to try to get as much information as we possibly can and work very closely with environmental health as well as state. So any questions?
Folks? Seeing none, thank you so much. Family planning, please.
Good afternoon, Board of Health, Mandy, Plumbing Program Manager. It's been a pretty difficult month in family planning. Our patient numbers are staying steady, as well as our unduplicated visits. We did a lot of outreach and education in the month of June, reaching almost 1,000 people in our community. For our harm reduction program, our syringe collection and distribution is staying pretty relevant to what we're giving out and what we are bringing back in. As far as Narcan, we still have limited supply from the state, so we're doing our best to ration it amongst our community, and then we are responsible for Region 6, which spans from Libby all the way to Hamilton. So we're also doing our best to give it to folks who need it while still trying to have some stock. And the state's hoping to get more Narcan funding in September, and I think we'll be able to come pretty close to still having stock in September. And then I know you guys were curious about data on using naloxone. And so within our program, the people we give it to, directly participants in our harm reduction program for Q1 and Q2. In 2024, we gave out 188 doses that were used. So participants that they either got it used on themselves or they used it on somebody else. And then we just received some data from the state regarding first responders, and in Q1 and Q2, first responders reported using naloxone 738 times within the state of Montana. We asked for a breakdown by county, but haven't received that data yet. However, they were saying that they're finding that correctly documenting naloxone has been challenging, and about 42% of the time it hasn't been correctly documented. So the state's working with first responders on this new database to teach them how to enter it. I think, you know, folks are trying to save somebody's life, so things get missed, but the overdose task force is working with first responders so we can get that data more locked down and have better numbers to report out. Any questions?
Questions, board?
So, see, 180 some doses were used in those 2 quarters,
Within our harm reduction program.
and with that, but what? And it's okay to use it even though someone isn't near death, okay, don't get, I'm not, question, I'm just saying, is it being used, sometimes it's being used, for example, if someone's unconscious and they get it, but that's not necessarily the problem, as an overdose.
Sure, I would say because of our harm reduction participants with their risk, that the 188, I would really correlate to someone most likely overdosing because of their risk factors.
It's not, it's unreasonable to say though that without naloxone, there would be 188 deaths. No.
No. Other questions?
Hey, thank you for that. Being done, thank you. Environmental health.
Brock is out conducting the public's business today, so he asked me to address any mosquito questions that he had. I think that those numbers were provided as well. I can quickly go over them. Between June 20th and July 18th, they had 765 inspections. 136 treatments, 67 acres treated, 4 new sites added, total of 1,645 sites. I know Brock has been out trying to do fogging in the evening on North Ferndale, Swan River Road, and Robacher's Farm and Manning Road. The seasonal help has ended for the season. He said they're seeing Kulik mosquitoes that are hatching and pockets are being found throughout the county. Said that the lack of rain and warm weather is drying up some of the areas that have been problematic, so that's helping out a bit, so. Really with environmental health, just a couple of things that I wanted to highlight. We had Under the Big Sky this last weekend. And one of the superstars in environmental health, and you've probably heard me mention her name previously, is Danielle Pierce. A number of years back when Under the Big Sky kicked off, Danielle volunteered to kind of shoulder that burden of dealing with not only, you know, the food inspections, but also wrangling the food vendors to get their applications in, the permitting process, licensing process. She's also She doesn't deal directly with the septic aspect with all the porta potties and hand washing and all that. But she does the inspection for the certified water hauler. And so she, you know, it's a group effort, but I really want to highlight Danielle because every year she's the go-to person for the event organizer. You know, done a phenomenal job. And we've seen that in the progression of how that event has gotten better from an environmental health, public health standpoint. Things that were just absolutely deplorable at the beginning where they were just running gray water out into the farm field and all that stuff. None of that is going on now. You know, it's just little tweaks. They installed a cistern for potable water up there this year. We went out and inspected that, identified that there were no backflow prevention devices on it. So quickly they acted on that and got that remedied. They had 19 food vendors that they inspected. The certified water hauler, which as a side note, we have no certified water haulers in the county, in Flathead County. This guy comes up from Lake County every single year to do this. There was a tattoo artist that was there. They have that every year. They were inspected. And then, of course, I mentioned the water cistern. So the next thing that I'd like to talk about, I just looked briefly today at, from an air quality standpoint, because now, open burning is not, it's closed, as of July 1st through the end of September. But the numbers there, we had 4,701 burn permits from January to June. Of those permits, 3,393 were new permits, 1,308 were renewals. We had a total of 9,030 activations for open burning. 6,051 of those were on the internet, and 2,949 were phone activations. Those two numbers surprised me because in my mind, it's certainly easier just to pick up the phone and dial the 800 number. But I'm happy to see that because they can do the internet activation for free. Each time they make a phone call, it's 15 cents a minute that we're getting charged for it. So as a side note to that, one of the metrics that we've pursued is the use of the air quality budget. We get a grant every year for approximately $50,000. The first year that it came to environmental health, 3 years ago, we were using 8% of that budget. This year, my goal has been 90%, to use 90% of it. This year, at the end of the fiscal year, we're at 73% from 8%. So we'll get there. We're working on it, but we'll get there. I think that's been a significant improvement. So that's all I had for you today, unless you have questions for me.
I do. Under the Big Sky, where did they end up taking their septic or their porta potty stuff?
Go ahead.
It goes to A1. So the gray water, I think, is going to Hot Springs.
Okay,
And the porta potty stuff is going to A1. So
okay, so A1 was what did it.
I think they've signed a long-term contract with them, is what I've heard. So
Okay.
Any further? Thank you. All right, finance.
Good afternoon, Kirk Zander, accountant for the Health Department. The numbers in the finance packet are preliminary. We're in the process of closing out the books for the end of the fiscal year, but we've got about 1.4 million here at the end of June, so we're in good shape cash wise. And that'll get reduced just a little bit as the stuff gets booked in. But again, in relatively good shape. So on page 1, right there, yeah, thanks, no. You can take a look and see how the actual year-to-date numbers are looking. Revenue came in at about 3.7 million, expenditures 3.5 million. So we had an excess of about $211,000. Of course, the original budget, we were estimating a deficit of about $237,000. So a lot of that's due to the budgeting for immunization revenues. And so the revenues came in, the expenses also came up along with that. So if you look in the far right column, under the variance, you see fee and other revenue where that immunization revenue is in there at 475,000 and includes a few other things, but and then the supplies down below on the far right, 286,000, that was the cost of the vaccines associated with those revenues. But what helped us out, we did have some vacancy savings in immunization. We had a community health nurse that was gone for the year. And so that offset the expenses, and so that revenue, that cash revenue dropped to the bottom line, so good shape. Any questions on the finances?
Oh, good.
Okay, thank you.
Health officer report, please.
So, Austin's been doing a great job with the animal shelter. The staffing issue has been an issue, just for the hires that we've had, haven't worked out for, two of it. It's actually the same exact position and they just haven't worked out to no fault of, anybody at the shelter. It's just the individuals that we hired just, didn't work out. So, but they, like he said, they're at capacity. If anybody knows of anybody that wants to foster or adopt, please, send that information out there. They're trying to do their best to get the dogs out, especially the ones that maybe have been there for a while, and get them into a home, at least a foster home, to maybe to kind of take a little bit of that shelter edge off of them. And the volunteers out there have done a phenomenal job in helping us, when we've needed, help. Austin, was incapacitated a little bit, with his arm, and volunteers came in, all over the place to help and to, make sure the animals were still cared for, and obviously with our staff as well. And the staff that we have down there right now, that are employed are phenomenal. The animal handlers do such a good job down there, and really try to work with the animals to get them out for adoption. So I just wanted to give them a shout out for that. And then I also do want to say congrats to the breast and cervical health. So when we had healthcare reform is when kind of we stopped meeting the goal. Other people were able to access breast and cervical exams and get them paid for through their insurance. And so when those things kind of changed, we had to change how we were doing things. So it's a huge accomplishment. We were probably one of the only ones in the state that actually meet our goal. We also have the highest goal in the state. That's the, even compared to Billings or Missoula that have higher populations. For whatever reason, we've always had a higher goal, and I think it's because we've done such a good job up here in getting people enrolled and getting those things and getting the breast and cervical exams paid for those individuals. So congratulations to that staff. They did an amazing job, and you know, I think they probably want to even exceed that goal next year from what they met this year. So they're very determined, and they're working very closely with Lake County and the tribe. And we know that you know, tribal members sometimes do not seek medical care. And they are working with the tribal members and the tribal council and the individuals down there, and they're helping them try to get more into the community and doing outreach there as well to get those individuals screened. So they're doing a great job. Good news, our co-responder, we have our second co-responder hired and has started. Got him in the house, and so he's going through some training right now with Winkery, and doing some ride-alongs and those kinds of things. I don't think it's gonna take him very long. He has a pretty robust background that he'll be able to hit the ground running. So I know law enforcement is excited. I know that fire departments have reached out to us, and they're gonna be doing some responses with them as well. KFD reached out to us, and we're just treating them kind of like KPD, and we will respond if they need us to respond for that. So we're super excited that that's happening. We are getting the other positions. I believe Tammy is gonna go up to the commissioners next week to get the other positions hired that go to support that position. So that is growing. We also received the crisis diversion grant that has not gone in front of the commissioners yet, but we did just receive notification that we received it. So that'll help expand that program and help supplement it. As we start to bill for Medicare, Medicaid through that program, Medicaid monthly through that program. So that is really good news. And I would like to thank the environmental staff, and, you know, thank you to our applicants as well for the diligence that you guys have done to get your variance, pushed forward, and for Jake and Jim and the rest of the environmental health staff that have worked very hard, to try to make everything work for them. You know, they try their best to help everyone that they can, when they come through the doors, so, but congratulations to you guys, and I'm happy for you that you can move on. And then also for the food staff, they have been working, so diligently this summer, the environmental health, it's not just under the big sky, there's a scout and gather, there's Rebecca Farms, there's all of, you know, the art in the park and all of those events that we have. Just think about how busy they are throughout the whole entire year, and then we have our summer, and they are 2 to 3 times. They are working late nights, they are working on weekends, they are coming in, they're doing it without a single complaint. And, you know, just doing their job, and we appreciate them so much, and I just wanted to, you know, pass that on to them, because and along with the land people, because obviously we know that land is absolutely crazy right now, but the food as well, they have done a phenomenal job. The air quality, we have sent out a kind of an alert. Obviously the air quality, everybody woke up this morning and thought there was a fire in their backyard. At least that's what I did. I'm like, oh, do I need my go box? So we are sending out, air quality information, just trying to get that out there, asking our other agencies to share that information. We obviously don't have as big of a, following as say the sheriff's office or OES, but we're asking them to do that. We know that their sensitive groups are gonna be, probably really hurting, you know, the ones that have asthma and, some, you know, asthma and just elderly people are gonna be hurting, so giving people suggestions of what they can do to try to get out of that smoke, because, apparently we're gonna enter smoke season earlier this year. I talked to Juanita at OES today, and she did say the fires are coming from the Washington and Oregon, southern Oregon and northern Washington, with that weather system that moved in, which gave us a little bit of rain, brought in that smoke with it. So we could probably expect to see that, as fires start to pop up, and as they are, you know, undoubtedly will start to pop up in, Montana as well. So we are monitoring the air quality. We, as soon as sports start, that is when, Jim and his group, start reaching out to the, athletic directors across the county, and just, you know, letting them know, especially with those cross-country runners that are doing those sports that are really gonna affect their lungs. We just give them recommendations of when those kiddos should be running and doing those kinds of things, and when they shouldn't be, and really working on being able to see, you know, how far you can see. If you can only see a mile, you really shouldn't be out there running. You know, if you can see 10 miles, you're probably in a little bit better, but still use some caution. And so we'll be working on that through August. And I know we don't have a meeting in August, so I'm just trying to, you know, we are gonna be gearing up. We don't have a community health update. They're actually at trainings in Helena, but we will be starting with the school immunizations, and those will be gearing up for August. August is one of our busiest times across the board in all of our divisions. Lisa and her staff and Jim and his staff with that E. coli cluster, they have been going very hard at it and trying to drill down, and hopefully we'll have some information. And I will brief you guys once we have to determine stuff. I will send out an email and brief you guys on what was determined, but we want to let all of the agencies do their due diligence and drill down to the exact cause, and then hopefully we can stop it so we don't have any more cases come through. So any questions on all that?
Oh, good.
Yeah. Okay.
Thank you. Committee reports, I guess we've already kind of covered our environment and health committee. It was a really good meeting, and we just kind of left that meeting hoping that someone being able to get approval for this in such a tough spot. We think there's probably a lot more out there that could be utilizing a system like this to save our lakes and rivers from any further pollution. So that's kind of where we left it. And it was a good meeting, and congratulations, guys. Again, thank you for your hard work bringing that forward. Do you have anything else, Art?
Nope.
No. All right. Board member discussion. Anyone have anything you'd like to visit about?
Just like make a comment about your comments about staff and how busy they are and how good they work. And I've been saying this as long as I've been in government service, that we have phenomenal employees, the city, the county, and the state, the people that you work with. People need to know government works. And I'm sorry for our applicants, sometimes it works very slowly. But I hope you can see why it operates that slowly. I mean, the care and concern that everybody gives to this, there's a reason it works slowly. But it's to your advantage, it's to our community's advantage. And we're just lucky to have the quality of people that we do. And it wouldn't surprise anybody, I like the local control. I really appreciate, you know, your subcommittee's, you know, finding, because that's what I would have wanted as well. And I think that we are smart enough, intelligent enough, we have enough common sense that we can make those decisions. And with the US Supreme Court Chevron ruling, maybe we'll even have more ability to not be hamstrung by bureaucratic regulations that sometimes don't keep up with technology and sometimes just don't make sense for where we are, you know, geographically. So again, government works when it's not hindering the workability part. But anyway, congratulations to everybody involved in that whole process and your staff.
Anyone further? This is a brief update. We'll be interviewing our two candidates for assuming city manager on Tuesday, and we should have a new city manager in place in a couple of weeks
In Columbia Falls.
in Columbia Falls. And also the EPA representatives were in town yesterday having to do with the CFAC issue, the Superfund issue, and thank you to the commissioners for penning a letter allowing us to move forward with that process. So again, the city of Columbia Falls is very happy to see that happen. Okay, if we don't have any further business, I have a motion.
I move to adjourn.
I'll second that.
Motion's been made and seconded to adjourn. All in favor?
Aye.
Meeting is adjourned.